Need for study. Stress and burnout have far-reaching effects both for nurses in their clinical practice and personal life. If nurses continue to work in their current environment without issues being tackled, then burnout will result. Burnout has been explored in healthcare professionals around the world, and the studies have involved all the types of healthcare professionals: general, out including allied healthcare professionals, medical residents and fellows and dentists. The rates of burnout vary among these subgroups. General, the rates are higher among healthcare professionals than among individuals in no helping occupation. Out has to burn been studied most extensively in physicians and nurses. Assumption. The assumption of my study is, staff nurses working in critical care unit may have mild to moderate burnout with positive coping strategies. An exploratory study is an easy method to assess the burnout and coping strategies among the staff nurses working in critical care unit. Inclusion criteria. Staff nurses working in critical care unit may have mild to moderate burnout with positive coping strategies. An exploratory study is an easy method to assess the burnout and coping strategies among the staff nurses working in critical care unit. Staff nurses working in critical care unit. Staff nurses having experience of more than 6 months working in critical care unit. Staff nurses interested in participating in the study working in critical care unit. Exclusion criteria. Staff nurses having experience of fewer than 6 months working in critical care unit. Staff nurses absent on duty. Delimitation. Delimitation in research refers to choices that the researcher makes for the study that is under the control of the researcher. The study is limited only to staff nurses working in critical care unit of selected hospitals in Indore, Madhya Pradesh, India. The study is limited to staff nurses having to experience more than 6 months in critical care unit. Research methodology. It describes the rationale for the choice of the design, the setting of the sample and sampling technique, sample characteristic, description of the instrument, validity, and reliability of the tool, pilot study, data collection procedure, and choice of statistical analysis. Research methodology is the technique used to structure a study and to gather and analyze information in a systematic fashion. The descriptive research approach method was selected for the present study. Descriptive approach is used to observe, document and describe a phenomenon occurring in its natural setting without any manipulation or control. These studies are designed to gain more information about characteristic within a particular field of inquiry. As the present study was concerned with accessing the burnout and coping strategies adopted by the staff nurses working in critical care unit. Research design. The research design is the overall plan for obtaining an answer to the question being studied and for avoiding some of the difficulties encountered during the research process. The research design is the plan, structure and strategies of investigation of answering research question and the overall plan or blueprint the research select to carry out their studies. For the present study, exploratory survey design is selected. A survey is a research design, which is used to collect information from the different subject within a given population having the same characteristic of interest. A survey helps to collect a wide range of data from a given population such as actions, attitudes, opinion, perceptions, behaviors, awareness, practices, etc. 1. Research approach. Descriptive research approach. 2. Research design. Exploratory survey method. The study is conducted in critical care units of multi-specialty hospitals: Bombay Hospital, Indore, CHL, Apollo. A sample is a small proportion of population selected for observation and analysis. Sampling technique. It is the process of selecting a portion of population to represent the entire population so that inferences about the population can be made. Sampling technique used was non-probability convenience sampling. Sample : For the present study sample are the staff nurses were selected from critical care units of one of the 2 multispecialty hospitals in urban areas, as per their convenience on duty. Sample size: The sample size taken for study was 100 staff nurses having more than 6 months experience working in critical care unit. Population: A complete set of elements, persons or objects, that possess some common characteristic defined by the sampling criteria established by the researcher. Target population: Target population: In my study, the target population is all the staff nursing of critical care unit. Accessible population: In this study, the accessible population is the staff nurse working in critical care unit of selected hospital and having more than 6-month experience.